Hello, my name is Fidele and I'm going to present about a project which is called Approaches to Healthcare Career. First of all, in this project, I'm going to start with the career paths available in healthcare industries. Deciding your general career path can help a person to figure out what he wants from a healthcare job. If someone has dreams of working in a healthcare organization, it can be difficult to know where to start since the industry there are many types of healthcare careers to choose from. Firstly, a person has to look or think about the career paths in order to see which ones fit best with his need or uh, his goals. Career and technician education has five distinct pathways for studying interested in pursuing a career in healthcare. The first pathway is diagnostic services, therapeutic services, health informatics, support services, biotechnology, research and development. To explain these pathways, let us start with diagnostic services pathway. This is the pathway this is pathway which is made up of career that used to test, to detect, to diagnose, and to treat disease, injuries, and other physical conditions. There are some common careers that fall under the diagnostic services. Those careers are the following. The first one is radiology technician, ultrasound technician, dental laboratory technician, and so on. The second is therapeutic. The second explanation of therapeutic service pathway. This is the most popular pathway in health science. It is because it focuses on working with patients to provide care, treatment, or counseling in order to improve the patient's status over time. To work in therapeutic services, it requires to have great communication skills to effectively work with patients, relatives of patients, and other healthcare professionals. There are some common careers in therapeutic services. The first is certified nurse assistant, pharmacist, and occupational therapist. Paramedic, respiratory therapist. Healthcare informatics, that is the third pathway. This is a pathway that involves with a wide variety of occupations that are made up of people responsibility for managing patient information, financial information, and the computer application related to healthcare. With the healthcare informatics, providers are required to be able to analyze medical data and knowledge about using correct codes for insurance and documentation. The health informatics pathway is composed by the following careers. The first one is medical administrative assistant, health informatic technician, nurse management, medical transcriptionists, healthcare administrators. The fourth pathway is called the support services pathway. This pathway is this is a pathway that is often unnoticed by patients, but it is what keeps healthcare facilities running. Support services workers used to work behind the scenes in order to ensure that other health care professionals can accomplish their duties. The support services pathway is composed by the following careers. The first is biomedical equipment technician, medical librarian, hospital maintenance engineer, central services technician, and so on. The fifth pathway It's called biotechnology research and development. Biotechnology research and development. This is a path. This is a path of very great people or students who shine in science classes. In this path, it includes a range of careers that use advanced science and technology to improve healthcare. Briefly, this path is highly focused on science and math. This means if you have a strong ability in this area, it is something crucial for success. This path is very important. It is because people who work in this path discover new information that paves the way for better treatment and medical services. This path may be constructed by the following careers. The first career is biomedical engineer, cytotechnologists, epidemiologists, and so on. Moving forward, I'm going to now say about the examples of non-clinical healthcare jobs and descriptions of the education and skills necessary to work in. The non-clinical employees are not involved or concerned with the direct observation and treatment of living patients. Non-clinical law are laws which do not provide any type of medical treatment or testing. Non-clinical employees can interact with a patient but not provide the medical care. There are some roles or jobs that a non-clinical person is allowed to do or are allowed to do. For example, non-clinical employees may be or may become a medical biller and coders, transcriptionists, laboratory technicians, hospital executives, receptionists, and other workers who work behind the scenes at the hospital, such as human resources, ITs, biomedical technicians, administrative assistants, and so on. Moving forward, I'm going now to say about the description of education and skills necessary to work as a non-clinical worker. Medical billers and coders. The billers and coders are required to have some skills as other secretaries and administrative assistants. So these people are required to learn or have the following skills: strong decision-making skills and ability to prioritize tasks and good judgment, excellent interpersonal and organizational skills, understanding of account receivable process and healthcare records, and proficient with computers, including billing and coding program and the recording systems. Means this person have to have the computer skills, knowledge of medical terminology and the related industry code. Moving to transcriptionists, these workers are required to have or learn the following skills: ability to manage time or time management skill, comfortable using using the computer, means computer skills, critical thinking ability, means to have the critical thinking skills. Also, the person have to have the good listen. Should be a good listen and strong, and should be strong at written communication. Means have to have the communication skill and the listening skill. Laboratory technicians. This is another technology technicians. The worker should have the following skills. This worker who is laboratory technician have to have comfort, have to have the following skill. Comfort with technology means technology skill. Ability to focus on every details. Stamina to work on his feet for a long period. Ability to fit to leave things as needed. Moving forward, now I'm going to give the explanation of allied health professions and examples and brief description of 6 allied health professions. The allied as a definition. The allied health professions are professions that are involved with the allied health which can be defined as part of healthcare field that provide services involving the identification, evaluation, preventions of disease, disorders, dietary and nutrition services, and rehabilitation and health system management. Descriptions of 6 allied health professions. The first one, ideology. This is a study of hearing disorders, including evaluation of hearing functions and rehabilitation of patients with hearing impairment. Cytotechnology, this is a study of cells. The cytotechnologist is solely responsible for the microscopic interpretation. Moving to another area, dental surgeon. This is a profession that study and the practice of techniques that are designed from improving the health of gums and teeth. Dietics. This is a health profession that is concerned with the diet and its effect on health of human being. Emergency medical science. This is an allied health profession, which is acronym of emergency medical service. Especially, this term is used to mean the medical professionals who respond to 111 calls and treat and transport people in crisis health situation. Health information management. This is an allied health profession that refers to correction and analysis of healthcare data that can be used to provide information that can be used in taking the healthcare decisions involving patient care. Institution management, healthcare policies and planning and research. Thank you very much. This is the end of my presentation, and I think this information will be beneficial for you. Thank you.